students to gain crucial insight into the various health fields. And without further ado, we're going to go ahead and get started with a couple housekeeping things before we completely send it. Go ahead and drop in the chat where you guys are Zooming from. Pre-health shadowing not only connects students from around the US, but around the world. We're actually open to anyone who has access to our website for absolutely no cost. So it's always fun to see where people are calling from. If you are not receiving emails and you would like to, you can go to our website, prehealthshadowing.com/join us, and put in your email. You're going to want to mark all of our emails as important and save pre-health shadowing as a contact. If you do this, your email is going to recognize to skip the junk folder, skip the spam folder, and skip the promotions folder and send it straight to your inbox, exactly where you want to see it. So if you're looking to get exclusive opportunities and information, we do have some cool deals coming for you guys soon. Be sure to sign up for this ASAP. We do have an update. Pre-health shadowing now has closed captioning for all of their live sessions to accommodate students with hearing disabilities. Pre-health shadowing's goal is to create flexible and accessible learning opportunities for students, and we want to ensure that all students of different abilities are able to reach their professional goals. If you are looking to make a change during this COVID-19 pandemic, we have partnered with Mask for Mask, which is an organization, woman-led organization, I'd like to add, that for every 4 masks that are purchased, 4 masks get donated to a person in need. This may be a hospital that is lacking in resources, a homeless person or community, and just other people who currently do not have the means to keep themselves healthy during this pandemic. So if you are looking to get involved, please share this fundraiser and this code. You can use the code PHS15 for 15% off your purchase. If you share this, not only are you helping donate necessary materials to people who need it, but you also help our student-led nonprofit organization keep our website up. So all of the purchases that get purchased with our code, 10% of the proceeds go to pre-health shadowing and maintaining our organization. If you are interested in getting published, I do have some good news for you. Pre-health shadowing is taking submissions to be published on the official website. You can submit articles, reflections, reviews, success stories, and it will be reviewed by our editor-in-chief. If you guys are interested, this is an exclusive opportunity only for the viewers of our live sessions. You can only access this through the URL, so you must type in the URL. Please write it down if you are interested. That is www.prehealthshadowing.com/blog submissions. I'll give you guys a couple more seconds if you're frantically writing that down. You can also take a picture. Alrighty. I invite you guys to pull out your phone and scan this barcode. This will take you to the pre-health shadowing donation page. Like I said, pre-health shadowing is a student-led, student-based nonprofit organization. We are surviving off of the kindness of our community as we work to provide opportunities for pre-health students everywhere. And so we really appreciate anything you guys can donate. If you are not financially able, we completely understand. We just ask that you share this link with others. If you're a high schooler and you are looking to get more experience in terms of leadership and connecting with like-minded students, consider joining our HTP program. This is for advanced students who are interested in establishing pre-health shadowing as an organization in various campuses around the US. So if you guys are interested, you can apply on our website on the team application form and indicate that you are interested in HTP. If you are looking for a virtual mentor, we do have opportunities for that as well. Like I said in the initial polling, you can meet with a virtual mentor and get matched for free. So you have the potential to match. This is going to be a networking event where you can meet with up to 6 professionals over a 3-day period and get the opportunity to interview with them, talk to them, connect with them, send them your resume, and see if they would be willing to pick you up. This is by invite only to join this event. And so here is how to get your invitation. You're going to download the materials from our Google Drive. register as a volunteer on our website, post this bingo board on your social media. Once you get it all filled up, you're going to submit it to the Pre-Health Shadowing website, and that's it. It's that easy. That's how you get your RSVP code to join our mentorship networking weekend. So if you guys are interested, we do have this on our website with more information. If somebody could please drop this in the chat, it's going to be prehealthshadowing.com/mentorshipbingo1. There's going to be a hyphen between each of the words. Alrighty. If you guys are interested in helping out, I will go more in depth in this at the end of the presentation, but we are taking students. You can be a part of over 1,000 students who are helping grow pre-health shadowing in various regards and in various fields. If you guys are interested in marketing, advertising, business, grant writing, establishing connections, outreach, we have lots of opportunities for you to also start your own projects and lead a team of students. So if you're interested, check out our website for more information. Go ahead and post pre-health shadowing on your social media to get a chance to get reposted on the official page, and tag us at pre-health shadowing. Students are able to take a post-shadowing assessment to receive a certificate that verifies their virtual shadowing hours with us today. I encourage you to take good notes. Feel free to drop questions and comments in the chat throughout the session. We will ask them during the Q&A portion. Members of our student team will be recording your questions and asking them orally. I would like to welcome to you our professional for today, Annie Thatcher-Stephens. Welcome. Thank you for joining us.
Yep.
It's a pleasure to have you.
Sure. Time to do my screen share.
Yes.
Working?
Yep, looks good.
Perfect. All right. Hi, everyone. I'm Annie Thatcher-Stephens, and I'm a certified athletic trainer. I work at the University of San Francisco, California at the Medical Center. And I'm currently working in the Orthotics and Prosthetics department. So today I'm just going to kind of review my background of how I became an athletic trainer, kind of my career path in education so far, and then take you guys into doing what I do in my day-to-day job currently. So the first thing you'll know if you're interested in entering the medical field is it's basically all about collecting a bunch of initials behind your name. So before we get started, I just kind of want to explain what my assorted credentials mean and when I got them. So my most important credential is my master's degree, which is certified athletic trainer. And I got that credential in 2016, and it's a 2-year master's program. I've also been a certified strength and conditioning specialist since 2008. And that's kind of like, it can be a personal trainer or somebody that works with college and high school sports teams to help them get stronger. And then my most recent credential I got actually due to the pandemic. When sports were canceled, I had to find a new work environment. So I started working in the orthotics department, which is dealing with braces at UCSF, and I became a certified fitter of orthotics. For these credentials, each one is associated to a professional organization. So for athletic training, it would be the National Athletic Trainers Association. For my CFO, it's the American Orthotic and Prosthetic Association. And for the CSCS, it's the NSCA, or National Strength and Conditioning Association. Somehow they all have like matching blue fonts. Pretty cool. So my path was a little bit unusual, but generally speaking, the way that someone would become an athletic trainer is get interested in it in high school, either by being an athlete or maybe taking a high school sports medicine class, or maybe you just knew somebody that was into athletic training. From there, in the past, people have gone straight into undergraduate athletic training programs to receive a Bachelor of Science degree in athletic training. A couple years ago, maybe 5 or 7 years ago, they actually changed the minimal degree for being an athletic trainer to a master's program. So currently, the undergraduate athletic training programs are being phased out around the country. And I think that their last class that they admitted has already been admitted. So if you're not already an athletic training major as an undergrad, it's not going to be an option any further. So a different way to get into athletic training would be to do an undergraduate major such as kinesiology, exercise science, or pre-physical therapy. It's all going to be kind of the same thing. Another option that is available if you're just starting out or you're a freshman or a sophomore in college or a high school student is there's certain programs that are available that are 5-year programs, and it's a 5-year combined bachelor and master's program. With these programs, it's very accelerated coursework, and it combines your undergrad and your grad work into 5 years. So honestly, for these type of programs, you need to be a very strong academic student. You need to be really motivated, and you should have a strong science background from high school or your first few years of college. It's a good way to save money because you chop up your school, and graduate school is really expensive, but you have to be super, super focused to succeed in those programs. From there, most people who did an undergraduate major would go into an entry-level MSAT program, or a Master's in Science of Athletic Training. And that's the route that I took. So that's a 2-year program that you would attend after an undergraduate degree for somebody who's not a certified athletic trainer. If you did happen to get an undergrad athletic training degree, then you still have to have a master's at this point. So you would do an alternate master's program such as biomechanics, education, kinesiology, or another related field. But this is my path. So this is the number one thing I want to say to you guys today is a lot of people think of, you're going to go to med school, you have to take 5 years, 10 years, 20 years to get your degree. But pretty much any way you want to get into the field, there's a way to do it. And it doesn't have to be a straight shot from high school all the way through medical school or through athletic training school, physical therapy, whatever you want to get into. I actually was a pre-professional dancer in high school and then went on to get a dance degree in dance performance from the University of Hartford right after high school. And then after high school and after my dance degree, I was performing as a professional dancer in San Francisco Bay Area for about 8 or 10 years. But as you guys may know, the field of the arts does not pay very well, and San Francisco is really expensive. So I basically had to come up with a way to make money while I was also performing. At that point, I decided that it would be a good idea to try to start getting into the health field because I knew I always wanted to work in healthcare. I like working with people, and I thought the easiest way to do that was to start out as a personal trainer. So at that point, I got my CSCS certification. I basically just studied really hard for 2 months. They give you a big textbook, and then you take a huge exam at the end. So I studied really hard and took my exam and got my CSCS certification. So that way I could work as a personal trainer making like $20, $25 an hour while I was also dancing, as opposed to where I was previously working at Trader Joe's. Shout out to Trader Joe's, it's awesome, but it doesn't pay as well as personal training. Then at that point, I had been doing personal training and I was about ready to finish up my dance career. And I knew that I wanted to go on to graduate school. But when you go to dance college, you don't take all those kinesiology or pre-medical prerequisites. So I had a lot of science classes to catch up on. So I ended up going to City College of San Francisco and taking chemistry, physics, biology, all the prerequisite coursework. And at that point, I was still deciding if I was going to go into physical therapy or athletic training. And I really didn't know. They both seemed kind of like the same thing. You do rehab, you work with people who are injured. But I also needed to get shadowing hours. So one day I just walked into the athletic training room at City College and I was like, "Hi, I'm Annie. Can I be your intern?" And they were like, "Sure, we need an intern." And that's kind of just honestly how it started. It was just that simple of walking up and asking if I could help them. So I completed my shadowing hours at City College, and by the time I was done with that, I was honestly so convinced. Like I could work with athletes and hang out at football games and get paid, or I could work in a hospital and work with older people who are learning how to walk. At that point in my career, I was like, for sure, the athletes, I definitely want to work in an exciting, upbeat environment. So once I finished my prerequisites, I ended up attending Seton Hall University in New Jersey for my Master of Science in Athletic Training. Did that, came back. You could see down here on this little picture with my football players. I worked at Alameda High School for 4 years. Um, and it was really great. But then unfortunately the pandemic hit and all high school sports were canceled. So luckily for me, having that master's degree and the athletic training background enabled me to immediately transition into a new job working in the hospital. And that is how I ended up working with the orthotics department and got my CFO certification to work for orthotics. So we're kind of going to just go through the athletic training part, and I'll talk a little bit about the orthotics at the end. But the main thing is knowing what is an athletic trainer. A lot of people don't know. It's not as well known as physical therapy or occupational therapy, nursing, the other types of allied health professions. So an allied health profession is pretty much any health profession that's not literally a doctor or a nurse. It's the people that help out. Common ones are physical therapy, occupational therapy, or speech language pathology. An athletic trainer is somebody that is able to do all those things with an athletic population or people who are active. So we're not specifically working with people who are sedentary. We're not specifically working with older populations who are not active, but we can work with recreational athletes or professional sports teams anywhere in there. And they're part of the sports medicine team. Really, really important. If you learn one thing from my presentation, please know that athletic trainers are not the same thing as a personal trainer. I started out as a personal trainer, but it's a whole different thing. An athletic trainer is also not a strength and conditioning coach, a coach, an EMT, or a doctor. So some of the job settings that you can work in as an athletic trainer are working at a high school, a college, or professional sports. Those are considered the traditional settings. And that's how most people would normally think of what's an athletic trainer. They're the person that runs out on the field and helps the injured athlete and then helps them to their rehab. There's actually also a lot of jobs, and a really growing field is working in the industrial setting. So the industrial setting would be working for a company like UPS or Amazon, where they have a lot of workers that are doing manual labor as part of their job. They're lifting boxes, they're putting things on assembly lines, they're driving big trucks. And often those types of workers get injured a lot. And in order to reduce their workers' comp claims, they'll hire an athletic trainer to work with their employees. The industrial settings, I've never worked in it, so I don't really know, but it's a much more consistent job environment. So if you really want to have a job that's like 9 to 5, you know you're going to be done at 5 o'clock. That would be a good setting to look into. Traditional setting, it's all over the place. You work at a football game till 11 o'clock at night. Then the next day you're going to wake up, you got to be at practice at 6. It's kind of crazy, but I like it. Another big setting for athletic training that's also really growing is working for the military. So a lot of the bases around the country will utilize athletic training to help get people through boot camp. You're taking these random people that haven't ever worked out that hard in their life, and you're putting them through a crazy amount of physical exercise. So they're going to tend to get injuries, and athletic trainers can kind of help reduce the strain on the system and make sure that those troops are ready to go. And they would also help set up rehabilitation for them and how they're going to work out when they do get deployed overseas, like what kind of equipment. You're not going to bring 50 squat racks over to Iraq. You have to have mobile equipment, and so they'll teach them how to work out when they're out of the country. And then another setting would be what I'm currently working in is the medical setting. This can kind of look a lot of different ways and often requires an extra certification, sort of like how I got the CFO cert. You can work in the orthopedics department, which is working with orthopedic surgeons and physical therapists and people that work on bone, muscle, ligament, soft tissue injuries. That's what I'm doing. You can be a physician extender, which would be working like in a regular doctor's office as opposed to a hospital. And for physician extender, you're kind of like a medical assistant. You'll go in, assess the patient, take their blood pressure, get the history, and then pass that information off to the physician. Another common place for ATs to work is as a surgical assistant. So you can get a separate certification to be a first assist for surgery, and you'll be in the surgery suite and you're giving them kind of the tools, or you're holding traction on the patient while they perform the surgery on that body part. I can't believe I even forgot to put this on my slide, but another job setting for athletic training is the performing arts. It's not quite as common because most dance companies and like Broadway shows are still using physical therapists as their medical professionals, but it is a growing field and it's pretty interesting. So if you have a background in the arts or you like to sing or dance or any kind of theater, Cirque du Soleil, they also employ athletic trainers. So as far as athletic training goes, there's domains of practice, which is basically the scope of what you're allowed to do and what you're not really allowed to do. And it defines the difference between an athletic trainer and a physical therapist, an athletic trainer and a physician, etc. So these are the 5 domains of practice, and we're going to kind of go through each one and some typical things that you would do for them. The first one would be injury and illness prevention. And honestly, this is probably the most important part. Regardless of the setting, you're going to make your own life easier if your athletes or your employees or your troops don't get hurt to start. So a lot of this has to do with pre-screening, seeing what kind of movement deficiencies people have and how that might predispose them to getting injured later. So in a traditional setting, you're going to be doing preseason physicals, which is before the season. You want to make sure everyone has seen their doctor, they've had their heart checked, they've had their eyes checked. You document who has asthma, who has a heart condition, who has allergies, anything else that could get in the way of their athletic performance. As you guys know, it's really big in the news. Concussions are a huge issue, especially in football, but also in the military with blast injuries. And pretty much any active person can get a concussion. So in athletics, you do a lot of concussion baseline tests. Before the season, you're going to want to see how good someone's balance is when they're normal, so you can then cross-check when they get injured if their balance is worse, better, or the same. And then you're also going to want to test out their cognition. So if you can see on this picture on the left, all these guys sitting at the computer with little X and O's, they're taking something called the IMPACT test, which is a neurocognitive screening test. And it kind of just determines what type of memory you personally are strong at and what type of memory you personally are not that great at. It's not really trying to test you like a standardized test. It's just trying to see where you're strong and where you're weak when you are not injured. Then if you get injured, you can go back and you'll retake the test. And the goal is to try to match your scores to see if you're actually concussed or you're not concussed. This guy on the right doing the balance test, it's something called the BEST test. And you're trying to balance, because one of the things that's really affected when you have a concussion is your balance. So they test balance in several different positions. And then that way they can do a quick test on the sideline of a football game or in the field or at work if you think someone has a concussion. So our next slide is clinical evaluation and diagnosis. This is a part of every medical profession for the most part. And in athletic training, there's kind of two main ways that you'll go about it. One would be the guy on the top who's doing that shoulder evaluation. That athlete is clearly not dying. He has, some shoulder pain. It looks like his athletic trainer is doing a special test to check the integrity of his shoulder joint. So this guy probably went to practice, came to his trainer after work, and is like, "Oh, my shoulder's feeling really sore." So the athletic trainer is checking him out. On the bottom, you can see an on-field evaluation, and that's kind of a little more scary because this guy, football player, could be seriously injured, right? You have to see if you need to call EMS, you have to see if you need a doctor, if he needs to go to the hospital, etc. But regardless of what type of evaluation we're doing, we're always going to use the same 4 steps, and the 4 steps are called HOPS. So the first one is history. You're going to want to ask what happened. So for, say, the baseball player on the top, he wanders in there and he's like, "Oh, my shoulder hurts." The trainer is just going to ask him, "Tell me a little bit about it. What happened? Where does it hurt? Has this happened to you before? How bad does it hurt?" You always want to try to get an objective measurement from 0 to 10. Some people, every time, they're going to be like, "It's a 10. Some people are going to be like, "It's 0. It's 0. I'm fine. I just want to play." But you want to have an objective measurement instead of just they said it hurts. Then you want to get some info, like, did you hear a pop or a crack? And do you have any relevant medical history? In this part, really important to know, if they have any chronic conditions like asthma, or if they have a shoulder that's always popping out of the socket. So after you get the history, obviously it's going to be a little quicker on the field evaluation. You're going to do some observation. So observation is just anything you can see about your patient. Is there any obvious deformity? Is this person's arm cracked in half where there's not supposed to be a joint? Is their shoulder hanging out of the socket? Then you're also going to look for some of the cardinal signs of inflammation, which would be swelling. Do they have a normal range of motion? Like, can they move it in every direction? Is it red? Is it warm? Can they walk if it's a lower body extremity? How's their mood? Are they freaking out and crying? Are they going into shock? How are they acting? And then you always want to compare to the opposite side. Palpation basically means feeling somebody's muscles, joints, and bones and seeing if anything feels out of place. In athletic training school, you do so much of this. Most of our clinical exams and our practicals were based on things like palpation. So, for example, you would have your partner and then you'll be examining the shoulder and you would have to physically touch every bony landmark on your shoulder. Okay, touch here, find the little tip, that's your acromion. Okay, touch here, find the little tip, that's your deltoid. So you have to learn where all that stuff is and you have to know what it feels like in normal circumstances so that when something's wrong with it, you know that that's off. For this, you're always going to start away from the painful area and move towards it. Because if you go up to someone that's injured and you immediately start jabbing them in the part that hurts, that's not going to be too good and they will lose their trust in you. And then the final one, you're going to do some special tests. So special tests are clinical tests that assess the integrity of a joint or a muscle or a tendon. A simple one that you guys can do for yourself if you want is a test for carpal tunnel. So if you just pick up your arms like this, and then you're going to invert your fingers down, and you're going to press the backs of your wrists together and push your elbows down. Mostly you'll feel a little stretch over the top right here, but if you do have carpal tunnel, it's going to feel painful on the bottom side of your wrist right here. So most of them are pretty hard to do yourself, but it's just little things like that, putting your body in a position that will elicit pain if you have a problem with that area. So that's pretty much how it goes. And then hopefully you studied and you know what's wrong with this person, so you can either take care of them, tape them up, give them some stretches, give them some exercises, or if it's beyond your scope of practice, you have to refer them up to the next level of care. Boom. All right, so this one is honestly probably one of my favorite domains of practice, which is immediate and emergency care. All athletic trainers need to be certified in basic life support, which is sort of an advanced CPR certification for medical professionals. So you'll learn how to do CPR and how to use AED, automated external defibrillator, and also how to use assorted airways or oxygen or whatever else might be needed. At whatever setting you're in, mostly traditional setting, but also in a hospital, also in a industrial setting, athletic trainers are always the one that's going to be responsible for creating and implementing an emergency action plan. So in an emergency, the most important thing is that there's a plan and everybody knows their specific roles. So when something crazy happens, like I'm about to show you, it's really important that everything goes quickly and that nobody's trying to take over. Everybody has to know what's their role and stick to their own role. And when you're in assessing an emergency situation, your thoughts always have to be like life over limb, right? If you have a broken ankle, okay, but if your heart stops, not okay. So you always think of it in this like order. The airway is the most important. Like, is there open airway? Can they breathe? Or could we do artificial breaths if we had to? Breathing, are they literally breathing or not breathing? And circulation, are they bleeding profusely from somewhere? How do they look? Are they turning blue? Do they seem to have good blood flow or not good blood flow? So this video, I hope it works, we'll see. But this is an example of a football player named Eric LeGrand. He played for Rutgers University, which is in New Jersey. I think this video is from maybe 2010. It's a little bit old, but what happens is you'll see this football player come in and he basically goes straight forward with the top of his head into another one of the player's stomach. And that position of flexing your neck and twisting it is like the number one way to break your neck. So pretty much as soon as you see this injury happen, the guy falls down on the floor and you can see his legs just get super stiff out of nowhere. And then as soon as that happens, you'll see one athletic trainer run out, you'll see another athletic trainer run out, and then all of a sudden you have this whole team just going exactly by their plan. What ends up happening to this player, Eric Legrand, is he did end up being paralyzed, which is really sad and just basically a tragedy. But they were able to save his life, and he fractured his neck. And a lot of people, if it hadn't been handled properly or they hadn't done the proper procedures and plans, he could have died right there on the field. So I'm going to try to play this video. If it doesn't work, I will also put the link in the chat, and then you guys can just watch it on your own. Yeah. I don't think it's going to work, honestly. Fail.
All good. We can release it to our students after for everybody who
Okay.
joined us in our live session today.
Yeah, I'm gonna just put it in at the end because you can't see it. But anyways, this is a really good example, and you'll see exactly how it happens. Like, it's very coordinated, and that's the most important part of emergency care is you have to have that plan ahead of time. Nope, that's not it either. I'm missing everything. Okay, this one. So now we're going on to our next domain of practice, which is treatment and rehabilitation. So this one is actually very similar to physical therapy, and it's going to be basically providing therapeutic exercises and different treatments to your athletes and your employees. So you can see in a couple of these slides, the athlete is doing exercises. This guy's sitting on his stability ball. His athletic trainer is telling him what to do. Over here, you have the trainer is throwing a ball. The other one is kind of spotting this guy so he doesn't fall off and break anything. That would be therapeutic exercise, really similar to physical therapy. You'll also use different modalities. Obviously, everybody knows if you get an injury, the first thing you should do is probably put some ice on it if it's an acute injury, or if you're just sore, you can use heat for that as well. Athletic trainers are not massage therapists, but doing massage is part of our scope of practice. So you can do massage. Down here on this bottom picture, you'll see these metal tools. That's called instrument-assisted soft tissue mobilization. And this is a technique that was started in ancient China a long, long time ago. It's called gua sha in Chinese, but in kind of Western medicine, it's usually referred to as scraping or instrument-assisted soft tissue mobilization. There's a technique of it called Graston, which is sort of like the name brand version of it, and you can get a $3,000 certification in it, or you can just learn how to do it and get some of the knockoff tools, and that'll work pretty much just as well. So the point of that is to kind of break up scar tissue and adhesions that you might have after an injury. This guy on the top right, it's kind of my favorite picture because this is athletes, one of their favorite treatments. It's called electric stim, and you basically put these little electrodes on yourself, and it will send electrical pulses into your muscle, which helps to relax the muscle and kind of decrease pain. So that will help with the electric stim, and athletes like it because they can just sit there and drink their coffee and chill. And then another one would be therapeutic ultrasound, which is different than diagnostic ultrasound, like how you see babies. Therapeutic ultrasound is using sound waves to break up scar tissue within your muscle. Then there's obviously taping and bracing as well to help people. The final domain of practice for athletic trainings is organizational administration and professional responsibility. Honestly, kind of the most boring domain, but it's a necessary evil. So all medical professionals are required to maintain notes of whatever they're doing in their treatments, and they'll do that using an electronic medical record system. So after you see a patient, you'll go into your record system, you'll type out kind of what you did, that type of thing. And Other things in this domain would be budgeting. If you work at a high school or a college, you'll have a budget from the athletic department, and then they'll tell you have $7,000, order your supplies. Your order supplies, do your inventory. Another thing would be staff supervision. So if you work for a professional team or a college, you're probably going to have a head athletic trainer and then several other people who work underneath you. So you'll have to supervise them. Certification maintenance is a big deal for athletic training, but also for every other medical profession. You don't just graduate and then cool, go on for your 50-year career. You have to maintain educational requirements because things are constantly changing. There's always upgrades and sort of additions to current research and literature. So every 2 years, you have to do a certain amount of continuing education credits. You can do that by attending conferences, or you can do like free ones online a lot of the time. That's one of the bonuses for Corona, honestly. They put a lot of free CEUs online, and I'm like way ahead on them. It's great. Another thing you would need to do here is communicate with other members of the healthcare team. If you're an athletic trainer, you have to have contacts with people with doctors, with their physical therapists, and if they're minors, obviously with their parents. And the final one will be complying with your professional organization's code of ethics, which as an athletic trainer can actually get kind of sketchy because in professional sports, there's a lot of different like things at play. People are wanting to get promoted. People are wanting to get contracts here or there. People want to get paid more. So there's a lot of pressure from the business side and from the competitive side, but you always have to kind of stick with your guts and realize that you're there for the person's physical well-being. You're not there to make sure they play tomorrow. You're not there to make sure they win the Super Bowl. You're really there to make sure that their knee is healthy. And that it's hard. Honestly, it's hard. So my number one thing in this category would be no matter what field you go into, just make sure you have a professional mentor and somebody that you can really look up to in how they conduct themselves, like from an ethics standpoint. And I just randomly pulled this picture, but this is my professional mentor, Dr. Cindy Chang. She's a sports medicine physician for UCSF. She's the head team physician for Cal Berkeley Athletics. She works for the US Olympic team. And she was recently in charge of creating the bubble environment down in Florida for the WNBA. And they went through their whole season without a single COVID case. So she's freaking awesome. Honestly, if you're into sports medicine or medicine period, you should look her up. She's really, really interesting. Here's just some numbers about athletic training. Disclaimer, this is from all over the place. I was on salary.com, I was on NATA, and it's really all over the place, but I just try to kind of come up with some reasonable numbers. So there's about 40,000 athletic trainers in the United States. For comparison, there's about over 200,000 physical therapists. So it's a pretty small profession, kind of everybody knows each other type of thing. 37% of public high schools have a full-time ATC. In my opinion, that's way too low. A lot of kids get injured and a lot of high school athletes don't have access to other health care. The average salary for an athletic trainer is $47,000. Again, that varies so much from state to state and so much from like which type of setting you work in. You're going to make more money or less money. And for comparison, pretty much straight up PTs make more money. They're going to make more money coming out of school, and then they're going to just keep going up. So if you don't mind working in a clinic and you don't need to be in action, then PT is always going to make you more money. But there are ways to make money as an athletic trainer as well. So the NFL obviously has some of the higher salaries because they make the most money. But what this statistic really means, the NFL has the highest salary at the 75th percentile. So within the Professional Football Athletic Training Society, which is all the NFL athletic trainers, the ones who make more than 75% of them make about $180,000. Yeah, that's cool. But at the same time, all that's really saying is the top people make a ton of money. And there's a bunch of seasonal employees that make like $30,000. So I don't know. It's kind of like everything else in football. If you're the star, you're going to make a bunch, and there's a bunch of people under there just not really making that much money. I just had to do a shout out over here to this tiny one in the middle. She was one of my preceptors when I was in grad school. So she was my clinical mentor. And she's gone on, she left Princeton where I worked with her, and she went to work for the Kansas City Chiefs. They won the Super Bowl in 2020. And these are all the athletic trainers for the Kansas City Chiefs. And she won the Super Bowl, which is so freaking awesome. Julie, yay. So quickly, I'm just going to kind of go through some of the education prerequisites of how you would even get into athletic training. So before you go to a master's program for athletic training, you could either just go to a pre-health or kinesiology curriculum, which is going to cover all this stuff naturally, or you could be like me and go to community college and piece this together yourself. So you're going to have to take anatomy. Usually that's got like 5 prerequisites to even get into that class: exercise science, biology, chemistry, stats, physics, so hard, physiology or psychology, English, and social studies. As well, on top of those classes that you have to take, you'll also usually have to do observation hours. So you will probably need to do between 50 and 100 hours working with a certified athletic trainer. I did mine at City College. I pretty much just went to the training room for like 2 hours after school every day, and then went to football games and other games on the weekend. And I ended up having about 250 hours for doing that for a year. I put this random GRE thing on here because luckily you don't have to take the GRE for a lot of athletic training programs. I literally looked up 6 programs where you didn't have to take it, and I applied to all of those, and I got into some good ones. So you can take it, but a lot of programs don't require it, which I think is nice compared to other medical professions. You guys can read. I don't need to read this to you, but in an entry-level master's program, this is some of the classes that you'll take. I'll just kind of highlight some that I thought were really great. Pretty much physiology at the graduate level is so hard. It's like basically chemistry, but about the human body. Really complicated, but really interesting. And I liked that class because we were also combined with nursing students, occupational therapy, and physical therapy students. So it was a good way to kind of break out of my immediate group of athletic training friends. Exercise physiology, nutrition, and wellness was another one of my favorite classes. Exercise phys is basically learning the chemistry of the human body and how humans respond to exercise stress. So this class, we'd all show up in our gym clothes, and we'd get like electrodes put on ourselves, and we'd have to run as hard as we can on the treadmill until we're just like so sweaty and exhausted, and then check what our heart rate rhythms look like. And there was one time when my friend Kevin, it's called max like VO2 max test, and you go on a bike where you have arms going and your legs going, and you just go as hard as you can for 30 seconds. He literally went as hard as he could for 30 seconds, hop off the bike, ran in the hall, and threw a ball over the hall. And it was really fun because you're learning and you're doing science, but it's really engaging as opposed to just like studying on the computer or studying on paper. What else? Sports psychology, also a super awesome class. I think if I wasn't an athletic trainer, I would probably be a sports psychologist. And if you were into sports and you like working with people, but you hate like technical basic science, or you're really bad at it and just not passing classes, I honestly recommend going into sports psychology because it's a very growing field, and you're still going to need to learn statistics, but it's a little bit lighter on physics and chemistry and not really intense science class. Healthcare admin, that's where you learn about all the ethics and kind of how to run a healthcare profession, and also how to do your notes, which is really important. So at the same time in grad school that you are going through all of these classes, you're also doing 2 other things. Most master's programs, you would hear, like if you're majoring in English, you would write a thesis, right? And then it would be a big paper, and you have to go in front of a panel of your professors and defend your thesis. What's cool about athletic training school is that you don't write a thesis by yourself. You work on a graduate research project with a group. So much better. So this is me and my group in our fancy suits presenting at our national conference. And my research project was called Comparison of the Validity and Reliability of Tanita and Omron Body Composition Measures to Skin Fold. That's a mouthful. But basically, we were testing how accurate and valid those body fat testers are. So there's a little thing that you just hold on to, and it sends a circuit of electricity around you, and it will tell you like, oh, you're 22% body fat. So we basically had to collect subjects and then collect data and write a whole paper about it and present it at the conference. And then also while you're doing that, you also have to do clinical rotations. And that's basically where you get your hands-on skills and is by far the most important part of your education. For my school, you had to do a clinical rotation at a high school, a college, and general medical. If you were interested in professional sports, you could also apply to go work for the New York Jets or Giants. And then we had some with the Philadelphia Flyers for hockey, and there were some more. But I never wanted to work professional sports, so I just stuck with high school for one semester, and then I did 3 semesters interning at New Jersey Institute of Technology and at Princeton University for a year. Clinical was so hard because you're already going to school all day, and then you have somewhere between 25 to 60 hours a week of your clinical after you go to school. And it's basically just like an unpaid job. So you're getting to act as an athletic trainer, but you have somebody certified kind of watching you and guiding you if you have questions. It was super fun, but it's also really, really exhausting. I do have to say though, for athletic training, it's really nice how your clinical education is within your 2 years of grad school. There's a lot of medical professions where you finish your school and then you still have to go do a residency, or you still have to go do supervised hours for minimum wage. And I thought that it was really cool for my profession how once you graduated, like you're good to go, you go get a job. There's no like other stuff you have to do afterwards. And that I think is a big perk, because after you're out of grad school, you're so broke, you just want to start making money. So once you finish all that, you have to finish the final board exam, which is called the Board of Certification for Athletic Training. And it's 175 question multiple choice test on a computer. It's 4 hours. It's really stressful and scary. And I would say not just for AT, but for any medical profession you're going to look into going to graduate school for, check the board exam pass rates, because I know a lot of really smart people who went to kind of mid or low level athletic training programs who didn't pass their test the first time. And it's not because they're stupid, it's because they just didn't have the right education or the right information. Conversely, at my school, I know some less smart individuals who passed on their first time. And super proud of my school, Seton Hall. We had 100% pass rate for everybody that's ever gone to school there since the history of the program. So I think that's just really important. If they can guarantee that people are kind of in the middle of the pack academically, if they can guarantee that pass rate, then you're probably going to pass the test. So that was all going well. I was working at Alameda High School as an athletic trainer. Just full disclosure, at that job, I made about $45,000, and to live in the Bay Area, I had to have a second job as a personal trainer. It was hectic, but honestly, I loved it. Like working at a high school is so much fun. It's pure chaos all the time, but it's really fun, and you get to like interact with young people, and you basically spend your life watching sports, which is pretty great. But again, that's not enough money to live by yourself in San Francisco. So I had to have a second job. So I continued to also do personal training. But then the pandemic happened, and both my careers kind of got canceled in like 1 week. It was pretty crazy. So high school sports were all canceled. And then also I worked at a gym, and gyms were also canceled. So I was like, oh God, what do I do? Luckily, there was an opening at my current job at the University of California, San Francisco, Orthotics and Prosthetics department. So I applied for the job and I got it. Yay. So then now I'm working in the hospital for the orthopedic surgery department. And pretty much my day, I just put braces on people after their surgery. So I work in the orthotics department, and the other professionals that I work with are primarily something called a CPO, which is a certified prosthetist orthotist. This is an additional allied health profession that's separate from athletic training, but it has a similar pathway. You'll go to undergrad for pre-health, whatever, then you'll get a 2-year master's degree, and it's a master's of science in orthotics and prosthetics. Generally, these people come from the same type of kinesiology background, but there's also a lot of people with engineering backgrounds. So if you're really into machinery and different devices, if you're good at physics, this could be a really cool career path. And again, it's also a very growing field. Also pays pretty well, which is helpful. sucky thing about that though is you finish your 2 years master's program and you still have to do 2 years of residency, which are paid, but they're still pretty low pay. So the difference between what I do as an orthotic fitter and what a CPO does as a certified prosthetist orthotist is I only fit braces that are pre-made. So like if there's a brace, a knee brace, say, and it comes in size small, medium, and large, I get an order for the brace. I look at the patient. Oh, the patient is 6'7" and 300 pounds. Probably going to be a large. So I take the brace from the shelf, I go up to the hospital, and then I size the brace to them. What a CPO can do is they can make custom braces. So this is more talking about people with scoliosis or with a limb length discrepancy where one leg is 4 inches longer than the other. And then CPOs also work with our amputee patients, and they create prosthetics for them to help them continue to walk and be active even if they lose a leg or an arm. So just a few more things and then I'm done. So this is kind of what I do on the day-to-day basis. Basically, these are some of the types of braces that we offer at my hospital. And I get to work, I get my COVID screening thing, I put on my mask and my safety goggles, and then I come into my office and there's a whole list on our electronic medical record of what needs to happen that day. So I'll look it up. There's usually like 10 or 15 patients on there, and it'll say, hey, we need to order a cervical collar, which is this guy over here on the left. So same thing, I'll look, how tall is the patient? Okay, they're short. Get them the small size, put it in my bag. Then these second ones, these are called multi-POTUS boots. This is usually given away to patients who are in the hospital for a long period of time and they can't get out of bed. So if you notice on this little brace over here, the heel of the person, it's not touching the back. And that's kind of to help prevent bed sores or any other type of issues that would happen under their heel. And it also helps to keep their foot in a really good flexed position so that when they do get up and are able to walk, they're not walking on their tiptoes. This thing, you guys have probably seen this cam boot. It's basically if you have a really bad ankle sprain or a small fracture in your foot, that's what we'll fit you with. This one, this is crazy. I never thought that, 9 or 10 months ago, I was taping ankles of healthy teenagers and giving massages and watching football games. And now I'm working here with some very, very ill and very, very injured people. UCSF has one of the top neurology departments in the country. So I do work a lot with the neurosurgeons and the neuro nurses and the people in the ICU. A lot of the times they'll have a brain tumor or they'll have some kind of issue where they need to have a brain surgery, and they remove like one of their bones from their skull, their frontal bone or like the side bone right there. And then this person is alive and they're conscious and they're talking to you, but they have like skull in 3/4 of their skull and then just a blank spot where their head's squishy and you can like see their brain pulsing. Honestly, it's crazy. So before those people can get out of bed, they need something to protect their skull. And so we'll go and fit them with a helmet. So we take a measurement of their head and then size it to the helmet. And then we use a heat gun or an oven or something to mold the helmet down and make it fit directly onto the patient. Helmets. Then over here we have a typical back brace that I would use, fitting that to the patient, a post-surgical knee brace, and then an average wrist splint if you fall and sprain your thumb. So those are just some of the common things that I do every day. Yeah, that's pretty much it, honestly. I would say that I definitely miss the traditional setting because I think that's what I intended to do with my career. And I really miss being around healthy, young, motivated people that really, really want to get better. Obviously, the people in the hospital want to get better too, but a lot of the times they're really, really sick and it can get kind of depressing. But I would say that there are a lot of perks to working in the medical environment instead of the traditional setting, which is I only have one job now. I'm able to pay my rent. I make about $76,000. So going from one setting to another with one tiny extra credential, I basically make $30,000 more a year. That enables me to only have one job and I still live by myself in San Francisco and I can pay my rent. It's also kind of nice to work like 8 to 5. And for the most part, I leave my job at 5 p.m. In a high school or a college environment, You never know. Your athletes will call you at 2 in the morning. Oh, I don't feel good. Oh, my ankle hurts. I have a hangnail. You're just constantly needing to attend to your patients. Here, once I leave work, I don't think about work until the next day, period. That's it. So there's definitely perks to it, but I also miss the traditional like sports environment. Yeah, that's kind of it. I think that, I don't know, it's pretty good. I like my job. I miss the traditional setting, and I'll probably go back after the pandemic, but I'm really grateful to have a job right now. And I think that my athletic training degree and background is the primary reason that I was never unemployed in this like really messed up economy and this really messed up job market, because the skills from athletic training really translate over to basically any medical profession. And you also have that quick ability to think on your feet and kind of just be a team player in any environment. The end.
Thank you so much. That presentation was very informative and I love it. So we have a couple questions here in the chat. First is, how has your dance background helped you on a daily basis with your career?
Well, I think for number one is when you're trained as a dancer, like your number one thing is that you're a performer, right? So I think there's a couple aspects to that. One, no matter what environment you're working in as a medical professional, patient care always comes first. And you really just always want to make the patient feel like you know what you're doing, you're confident. Imagine, I went from a high school environment, again, healthy teenagers, to walking into a room to a patient that's missing their skull. And like in my mind, I'm just like, oh my God, that's their brain, it's pulsing. But I have that ability as a performer to just be like, hi, my name is Annie, I'm from Orthotics, here's your helmet. And I feel like just being able to like snap into a mode of being instantly confident is something that I for sure got from my dance training, because you're a performer, you just have to be on all the time. And the other thing I would say is, as a dancer, you're trained to really, really understand the human body. And not only did you learn it from a book and an anatomy class, but like, you know when your shoulders are forward or when your shoulders are back. You know when your head is down or when you're doing the forward neck texting thing. So having my own body awareness, it helps me to explain that to my patients like more clearly.
Perfect. Thank you. So right before I ask the next question, if any of you guys want to use the raise hand function and ask your question personally, you can totally do that. I will call on you or my other host, Isaac. But our next question will be, I'm sorry, I just lost all the questions.
Go ahead if you want.
Okay, yes, please.
The next question is, what is the most common injury that you fit prosthetics for?
Well, I think that at my current job, the most common injury isn't an injury. The most common injury is a back surgery. So since UCSF has like a really famous and good spine center, we see a lot of spinal fusions, which is when you have like so many problems with your discs in your back that they have to put a metal rod in to fuse a certain segment of your spine. So we get a lot of them for the neck, which is your cervical spine here. We fit a ton of those cervical collars for that. And then also for your lower back, and that was that backpack style brace. That's the most common thing here. It's not a lot of trauma. It's a lot of surgeries that are planned for long-term back issues.
Thank you. So why would someone prefer an athletic trainer over a physical therapist?
I think that it depends, because athletic trainers are trying to take somebody who's already at a pretty good level and get them to an excellent performance level. And they have more experience overall working with people at a very high level of like physicality. So physical therapy is often taking somebody with a serious injury and just trying to bring them back to normal. Athletic training is trying to bring them all the way back to being able to do athletic performance. And then the other primary difference is the emergency care aspect. I love physical therapists. My best friend's a physical therapist, but physical therapy tends to be very sort of by the book and very like, I don't know how to say it, like measured. You're always going to go through every single step of the evaluation, do everything exactly right. Athletic training, you run out on the field, you figure out if this person can walk, you got to decide, is it safe? Did they break their neck? Do we call the ambulance? Can I handle it? And it's just faster paced. So I think that's kind of the other thing, is the pace of the work.
Thank you. The next question is, was there a role model in your life that motivated you to pursue your profession?
So yeah, I think that, I mean, I have several role models, and like now my absolute idol is that woman, Dr. Cindy Chang. Everybody look her up, seriously, she's the coolest. But when I first started, it was really just the athletic trainer at City College of San Francisco. Like I walked in there and I was like, I don't know, hi, I'm Annie. I maybe want to be a physical therapist, or like maybe athletic training. Tell me what you do. And there's two of them. It was Addie and Jessie. And they literally just took me under their wing. Like I didn't know anything. I took anatomy classes. I was a dancer, so I was an athlete. I played soccer as well. But they really just taught me everything about the profession. And I think it was them that kind of instilled to me, just watching how they connected with their athletes and how they weren't friends, because obviously you have to be professional, but they just got so close to these people. And versus physical therapy, you're going to see that physical therapist, like you go for your appointment on Monday from 4 to 5. Okay, next Monday, 4 to 5. With athletic training, those two trainers, Addie and Jessie, showed me you can work with somebody every single day for 3 hours. And so they just kind of emphasized how this would be a good career for somebody that really likes to work with people and kind of have that type of relationship. So yeah, they definitely really inspired me. And it's really nice because they were so supportive when I was in grad school. And I mean, science is freaking hard. Like it's so hard, and I'm pretty smart, but like it was really hard. And so I would just sit in there struggling over my chemistry homework, and they would just be like, it's okay. Pretty soon you'll get to the real fun stuff. And I'd be like, but stoichiometry. And they're like, no, it's okay. We're going to get there. And so they really like helped me out through the crappy basic science part at the beginning to get to the fun stuff.
That's amazing. So this is a question pertaining to the patient you had where you had a helmet where they were missing a part of their brain.
Yeah.
The question is, does the skull bone grow back? Also, how long would that take?
So in this case, no, your skull bone doesn't grow back because I don't know how much of you guys know about anatomy a lot, but your skull is different bones. Like when you're a baby, they're all separated and they fuse together and get hard when you're like a little kid and really hard when you're an adult. But if they're doing a brain surgery, they'll usually remove like one chunk like that. And then they do the surgery, whatever, take the tumor out. But obviously when you do any surgery, you're going to have swelling. So that's why they can't like put the bone back, because your brain is literally swollen out of your skull type of thing. So what they'll do is they'll wait for it to go down. We'll put the helmet on so they have protection. They can walk, they can go to the bathroom. It's so crazy, honestly. I'm still just like, it's crazy. But eventually what they'll do, your bone is not going to grow back, but they put a metal plate in there. So eventually once the swelling is down and they are healed, basically, they'll put a plate in, close their skin and their muscles and everything back up over it. They wear their helmet a little bit more, but then the bone will grow around the metal plate to kind of like, it doesn't grow all the way back, but it grows enough so the plate's like stuck in there. Does that make sense? I'm not a brain surgeon.
That's very interesting. Thank you. The next question is, what was the craziest injury you've had to treat?
Craziest injury. Okay, so I have two, sorry. These are my two favorites. So my first crazy injury was actually when I was in grad school and I was covering rugby. And this kid, I honestly don't even know what happened, but it was some kind of elbow to the eye, basically. And it was myself and the certified athletic trainer at the time, because I was still a student. And this kid's just cupping his eye and he like runs off the field, but he's like swerving all over the place. And we're like, oh man, he's concussed. And then he gets to us and there's just blood like coming out of his eye. Like we couldn't even tell what was going on. And then you could tell he had split his eyebrow. So that was one thing, but he's just screaming. He's like, Annie, I can't see. Am I going to be blind? And I'm like, I don't know. Are you going to be blind? But I'm like, okay, everything's fine. So basically at that point, the other good thing about athletic training is you're never the answer. You're not the final step. All you have to do in that situation is get the kid to the hospital, right? Like, I don't need to save your life. I don't need to get your vision back. I just need to get you in the ambulance. So pretty much I just gave him a bunch of gauze. We cleaned him up a little bit. We're like, you're concussed. But what had ended up happening is he fractured his orbit, which is all the bones around your eye. He ended up having 6 fractures around his eye. And then he also had detached his retina. So that's why he couldn't see. But what we did is basically just give him a bunch of wet gauze, put it on his eye, tape it around his head, and put him in the ambulance. Then he had to get pins all around here. They reattached his retina so he could see. And that was in the fall semester. And by spring, he was back playing rugby. Like, what? That was wild. And then my other one, this is heck of fast, but my other one was at a high school basketball game. It was the year that our basketball team at Alameda High was really, really good. They ended up going to the state championship. So it was like really high pressure game, really great. And I think it was like 2 levels before the state championship. And it's in the middle of the game. And this kid gets elbowed in the face again. It's always an elbow. And he lost his tooth. His freaking tooth fell out. And so everyone stops the game and everyone's looking all over the floor for his tooth. And he just picks up his tooth and runs over to me. He's like, Annie, my tooth. And I was like, your tooth. And there's this stuff called tooth saver that's like pH balanced to your body. So I basically take the tooth, put it in that tooth saver thingy. And then I'm like, okay, are you concussed? Like, whatever. Turns out he didn't have a concussion. He literally just got his tooth knocked out. So I then made him put in a mouth guard, cleaned up his face. I was like, you need to wear this. His mom was there. He was a minor, so I had to ask. I was like, he's not concussed. He is missing his tooth. We need to call the dentist. Can he finish the game? And mom was like, yes. And I was like, yes. So then I get on the phone with the dentist and I'm like, dentist, he lost his tooth. What do we do? And then the dentist was like, okay, have him come here at, right after the game at 9 o'clock at night. And I guess then he went to the dentist. They put the tooth back in. I think he ended up having to have like a root canal or something down the line, but he finished the game and it was great. Very exciting.
That's honestly insane. Um, so is there anything you would have liked to know before you started your career?
Yes. I did definitely research like how much money athletic trainers made versus physical therapy. But at the time, I literally was just like, no, this is so fun. Like, I love this. I love sports. I don't want to work with old people. But now being an adult and living in the Bay Area where it's really expensive, I just think that I would have kind of gone about it in a little bit of a different way. Like, also my dance career was super fun and I loved it, but like I didn't really need to go get a 4-year degree to do that. So I just think I would have looked a little more into the like cost benefit of the price of school, and then also how much I'm going to make at the beginning of my career, because although I'm making like a good salary now, I had to like go up. Like, I didn't just start making a lot of money. And if you go to physical therapy school, you're gonna probably get at least like $60,000-$70,000 right out the gate, and just that adds up over time. But the other thing I want to say about that, and I forgot to mention this, is if you do work for any type of public institution, like a college or a public school or any nonprofit like a private school or a private hospital, there's this thing called public service loan forgiveness. And after you pay your student loans for 10 years, they wipe the rest of it if you qualify. So if you guys are getting into a lot of debt right now, you have to look into this public service loan forgiveness. And I'm 5 years in. So hopefully in 5 years, I'll have to stop paying the student loans and then I'll be better. Yeah.
Thank you. First off, I just want to ask regarding the basketball player earlier, did he win the game?
We did not win the game.
Oh,
We also
so
did not win the
it.
state championship or NorCal champs. But
wasn't worth it. So the next question is, what other careers similar did you seriously consider before choosing your current position?
The only other one that I really seriously considered was physical therapy and sports psychology. And sports psych was awesome, but I really thought about myself. And I don't know if you guys have noticed, but even just sitting here for like an hour, I'm a very active person. I'm an athlete, I'm a dancer. And like psychology is mad interesting, but like, what does your day-to-day job look like? You're literally sitting in a chair and you're talking to people. Cool, interesting, I like it. But to me, I was like, do I really want to sit in a chair for 50 years? Like, no, I really don't. And even though I'm not working in that traditional setting anymore, I still like I go 3 miles every day up and down the stairs of the hospital, all over the rooms. And so that's what ended up making me choose athletic training or PT versus sports psych. Like it's really, really interesting, but I just knew that I needed to have a more active career.
I totally feel you on that. So our next question is, do you work with physical therapists when in the process of patient rehabilitation?
I totally work with physical therapists, especially in my in my previous position at the high school. Basically, if somebody had surgery or they were more seriously injured than I had time to deal with, like in an athletic training room at a high school, there's 40 kids in there, and I'm just like, you, ah. So if somebody has a really serious injury and they can't come in late at night after everybody, then I don't have the time to do the proper rehab. So at that point, I will refer them to a physical therapist, and then me and the physical therapist would talk back and forth with our like our electronic medical records, so everything's confidential, HIPAA, all that, and just kind of make a plan. And then once they were ready to go back to their sports, the physical therapist would be like, hey, Annie, okay, I think I'm done with them. Like they're mainly good. And then you just help get them over that final hump to like playing back on the soccer field. And then in my current position, we work a lot with the physical therapist because they'll order, say, the back brace, and then I'll go up to the patient room and I'll be like, okay, you're a size medium, let's fix the waist belt. And then I will either be there at the same time as the PT, and we'll both together teach them like, okay, you're going to bend your knees, you're going to roll on your side, you're going to push yourself up, let's put your brace on. And so it's really collaborative. I work with the physical therapist here a whole bunch, and they don't know, I mean, they know how to put on the braces, but they don't really know like quite how to adjust them and things like that. And also just at the hospital, these patients are so sick and they're so immobilized that it takes several professionals to like safely have them walk down the hall, you know? So that's another way we just kind of are an extra set of hands for the PTs to help them. Shout out.
Interesting. Thank you. The next question is, how many patients do you see per day, and how long would you say each patient interaction is?
Honestly, it super varies. Like today, I'm spending 2 hours with you guys instead of seeing them, so my coworkers are handling that. But I would say on the average day, on the inpatient side of the hospital, I would see like between 15 to 20 patients. And some of them, it's 2 seconds. Okay, here's your something easy. Here's your wrist splint. Like that takes 5 seconds. There's nothing to explain about it. Like put this on. Okay, great. Like, do you have any questions? It's not cutting into your skin. This is how you wear it. If you have any questions, my name's Annie. Call me back from Orthotics. Some things, a back brace for somebody that's paralyzed below the waist, or a back brace in the ICU when they have open wounds everywhere and drains of surgical blood and fluid coming out of them. That's going to probably take about 30 minutes, maybe. I think the longest I ever spend with a patient is about an hour, and the shortest is literally like 10 seconds. Like, here's your thing, okay, bye. It totally depends. It's all over the place.
Thank you. So what is the hardest prosthetic to fit and why?
So just to clarify too, like prosthetics means the things for amputees, like a fake leg, basically, if you got amputated. I don't do that, but I do the orthotics, which is the braces. The hardest, so I help with those, and like my coworkers do them, but I don't do that. But the hardest orthotic to fit is something called a hip abduction brace, which like, it's basically if you have a hip replacement and it wraps around your waist, and then it also like wraps down your leg. And there's just so many like straps and buckles. And you also have to think these people are in hospital gowns, right? So they're like naked in a gown, and you have to like put these straps on their like upper groin area. And obviously, like, I'm an adult, I'm professional, but it's still just a little bit awkward, and it can be uncomfortable because you're like pinching their skin in these like braces and stuff like that. So The hip braces are kind of the worst, and it's mostly just because it's like a pretty sensitive area, and the patient's feeling a little awkward, not to mention they're in pain, and I'm trying to be professional and all of that, but it's hard and it's like really personal, and they can't put that one on themselves. Like, it's easy to put on your own wrist brace, but it's not easy to put on your own hip brace. So that's where that becomes an issue.
Thank you. The next question is, what are your least favorite things about your job?
What are my least favorite things about my job? For this job, I feel like my least favorite thing is that some days it's honestly really boring. Like, it's repetitive. And in my other job at the high school, no day was the same. One day is concussion testing, one day is a volleyball game, the next day is a concussion, the next day is football, like it was all over the place. And here, for the most part, every day is relatively the same. And again, I'm just kind of a ADD type person. Like, I like different things happening, I like different environments, and so having it be really repetitive is boring. And I would say the other thing that's hard about this job that was not the case at my other job is some of these patients are very, very ill. And I mean, I'm not super young, but I'm pretty young and I'm pretty healthy. And I have an easy time relating to like teenagers, young adults, and athletes. I don't have an easy time relating to a 65-year-old that just got diagnosed with metastatic cancer and they have all these pathological fractures in their back because of their cancer. It's not because they fell, it's because they're dying, and it's just a different type of environment. And I tend to be kind of like silly and upbeat, and to walk into a room of someone that got diagnosed yesterday with a terminal disease and be like, "Hi, I'm Annie, do you want your back brace?" Like, I have to kind of like change out my personality and just be a little more serious. But so I don't like it, but I also think that it's a good learning experience for me, and it's like it's making me grow as a clinician. So like, it's not natural and I don't like it, but like, it's okay.
Thank you. So have you ever thought about getting involved in the surgical fields?
Yes. I was thinking about, there's something called, I'm gonna forget the credential. It's called like OTC. I forget exactly what it means, but it's the credential to basically be the person that assists with surgery. So you're not the surgeon, obviously, but you'll help to like hold the patient's leg while they will put it in the traction device, or you'll hand the surgeon the tools and stuff like that. And I actually looked a lot into those programs. It's the same type of thing as the certification that I just got for orthotics, but it's just surgery specific. And yeah, I did look into it. And at the time I thought like, oh, if I ever work at a hospital, I want to work in surgery. Like, surgery is so cool. But now that I'm here, I really don't think that I would want to work in surgery, because my favorite part of any medical job is patient care. And it's getting to know my patients, whether it's the 60-year-old with metastatic cancer or the 14-year-old with a sprained ankle. That's the most fun part. And when you're a surgeon or when you work in surgery, your patients are unconscious. So like, you don't get to chat with them while you do your thing. You just do your thing. So I don't think it's for me, but it's a cool job.
Thank you. The next question is, are there any resources for athletic training that you recommend for our students?
Yes, and I really, I think that you guys are gonna share the slides with everybody, but the number one thing, I'm gonna type this in the chat, is so there's an organization called CAATE, it's CAATE, which is the Commission on Accreditation of Athletic Training Education. So if you are thinking about going into athletic training, or you're even just, if you're already an athletic trainer or you're already trying to go towards that, it tells you, it has a website with like the list of every single program in the US, every like how expensive it is, what do you have to do to get in, does it require the GRE, what's the prereqs, like it has just all that type of info on there. And it's really well organized. You can look up undergraduate programs, graduate programs, and doctorate programs. So that's like by far the number one. The other thing would be NATA, which is just a National Athletic Trainer Association. The website's a lot, honestly. There's tons of stuff on there, but they also have a bunch of social media. So even if you just look on Instagram and look up like NATA, there will be the national one, and then each like state or group of states has their own, like for us, it's the California Athletic Trainer Association, or there's the different, like the Florida one. So all of those, I would suggest to follow all those organizations at the end of my PowerPoint, follow them on social media first, and then especially the Katie one, guys should really look at the website because it has a ton of resources on there.
Those are great. Thank you so much for those. The next question is, do you ever see yourself working in pediatric athletic training?
I'm literally at work right now, so, but yeah, that's definitely the goal. Like I really like working with kids and young adults, and pediatrics technically goes up to like 22. So even college is still considered pediatric from a medical standpoint. I do like working with kids a lot, and at my last job, I worked at something called the Sports Medicine Center for Young Athletes, which it was basically all pediatric athletic training stuff. And we covered a lot of like club soccer teams, and we did like camps for youth lacrosse teams and stuff like that. And honestly, to me, that's the most gratifying thing, because if you can teach little 9 and 10-year-olds to how to run properly and how to squat properly, they're going to just be way stronger, and then they're not going to get injured as much when they're in high school. It's way harder to train a teenager than to train a 9-year-old. Well, kind of, because 9-year-olds don't pay attention. But like, if you can get them to have good form and take care of their body and care and invest in their health when they're young, it's going to pay off way more in the end. So yeah, I totally love pediatrics.
Thank you so much for this amazing presentation. To wrap up, do you have any final advice for our students?
Number one, find a professional mentor. And I don't just mean someone who you like admire them, but somebody who you admire their character. Like that, I think that Dr. Cindy Chang person is awesome because she's like, she works for the Olympics. Like that's so cool. But that's not what I admire about her. I admire how she conducts herself and how she tells people the hard answer, you know, and I sometimes have a hard time with that. So I always think like, what would Dr. Chang do, right? And in my head, she always has the right answer, even when I'm like too scared to do it correctly. So I think that just having someone where you really admire their character is absolutely crucial. The other thing I would say is make sure you're trying to attend quality graduate school programs, because grad school is really expensive and it's really hard. Like, not even gonna lie, it's very difficult and it's going to be a taxing situation. So make sure that they have high board pass rates. Make sure it's in a place, like a physical place that you want to live. Like I also was maybe going to go to school at this school in Idaho, and it was really cool and I loved the school, but I just knew that I wanted to live in a city. I've always lived in cities. I think I'd feel uncomfortable there. So that's really, really key. And then the final thing is, if you have a lot of student loans, look up public service loan forgiveness. I swear, the more people do it, the more it's gonna kind of get the word out there. But that's really important too. Medical professions are expensive to be in.
Thank you so much for joining us today and spending this time with us to guide all of our students in their potential health fields. For all of my students, listen up. I will go over how to take the post-shadowing assessment to get your certificate that verifies your virtual shadowing hours today. Just a quick reminder to give yourself some time to reflect on today's virtual shadowing session. This is going to be really helpful as you are establishing your applications and just figuring out, what do you want to do, why do you want to do it, and how are you going to do it. And so these are just some topic starters. If you need some help, you don't have to turn these in, but if you are interested in getting published on the Pre-Health Shadowing website, you can submit them. If you wanted to write a reflection today, you can submit it on prehealthshadowing.com/blog submissions. If one of my team members can go ahead and put that link into the chat once more. If you are interested in submitting this, go ahead and click on that link, as it is only accessible from the link and not from our main menu on the website. If you're interested, you can email us at info@prehealthshadowing.com for the rubric. If you guys are looking for a mentor, like Annie was telling everybody is so crucial to have, if you are looking for a virtual mentor, you have the opportunity to meet with one at our mentorship networking event. This is an invite-only event, and to gain an invitation, all you have to do is post this bingo board, fill it up, and turn it in. When you do that, you will get an invitation to RSVP to our event and potentially meet a mentor for life. If you guys want some more information on this, feel free to check out our website, prehealthshadowing.com/mentorshipbingo1. Be sure to tag us on all of your social media posts anytime you do something cool pertaining to your health-related science. Pre-health shadowing on TikTok, Instagram, Facebook, and Twitter, and use the hashtag pre-health shadowing. Awesome. We'd love to see all of the great things you guys are accomplishing. Please help us keep pre-health shadowing free. You guys can actually get volunteering hours for doing this. So if you go to our website or scan this QR code, it will take you to our Join the Fundraising Team page. If you join the fundraising team and send out a specific number of links, you are eligible to get certified volunteering hours for helping us out. Be sure to send this to your family, your friends, your professors, anyone who's looking to see you thrive and support a student-led, woman-led nonprofit organization. If you guys are looking to get involved and get some leadership opportunities going, pre-health shadowing does have a student team. This is 100% remote, gives you the opportunity to not only meet with like-minded students nationally, but around the world. You also have opportunities to do professional outreach and gain professional experience. You can lead teams of students in your own projects. And so this is a really great opportunity, lots of room for growth here. If you're interested in applying, you can do so on our website, prehealthshadowing.com/join-our-team. We understand you guys are all pre-health students and time is not something you carry in your back pocket. And so if you're still looking to get involved but don't have the time to commit, we completely understand. You guys can still volunteer with pre-health shadowing. The cool thing about this is, as it is 100% remote, it's also on your own time, on your own schedule. So if you guys only have time,
just went to practice at 5:30.
Excuse me, can everybody make sure that they are muted?
Yeah, I'm waiting for my hair to dry.
Thank you so much. So you guys can set your own schedules. If the only time you have is at 2 o'clock in the morning, you are more than welcome to help us out at 2 o'clock in the morning. Tasks include professional nominations and student outreach. Oh, this was from today. We do have upcoming shadowing sessions for next week. Be sure to check out our website here at the bottom, prehealthshadowing.com/sessions. Now, finally, to get your certificate that verifies your virtual shadowing hours with us today, you're going to go to our website and find Annie's page on our website. Once you find her profile, you're going to click free, take this course. You're going to have 30 minutes and 2 tries to get over a 70% on the post-shadowing assessment. Once you pass the post-shadowing assessment, you come back and click finish course. If you do not click finish course, you will not receive your certificate. Please ensure that once you pass with a 70%, you download your certificate immediately. You can find it at all times in your profile under the certificates tab. If you guys have any questions or concerns, feel free to email us at info@prehealthshadowing.com, and we hope to see you at our future sessions. Thank you again, everybody, for joining us, and have a wonderful rest of your day. I invite you to disconnect from the call.